I started this clinic in 2019, so it's been more than 5 years now. I do all the ketamine infusions. We'll do ketamine injections, Spravato, TMS. So a lot of it's using my background as a nurse anesthetist and seeing how we can get patients better quicker.
I think I'm coming up on 6 months depressed and not well for the rest of my life. I haven't been on anything. I haven't been doing ketamine treatments, and I'm maintaining a normal lifestyle. I feel good now.
I would encourage every person to come to Ascend because they are truly listened to and their needs are cared for. They have a say in their treatment plan, how they receive services. We consider the very best approach for each patient's needs. We consider their social supports and other resources that they may have to maintain safety and comfort.
I was unable to socialize, and I started treatment here. I've come back to my life. It hadn't all of a sudden one day just come back, but it's every day I see that I am doing better and better and better.
I think there's a variety of therapists here. Males, females, there are people that specialize in trauma, there are specialized in family. So I think there's a good fit where they can find a fit.
So I've pretty much struggled with anxiety and depression since I was 13 years old. And I've tried probably 10 different antidepressants and just nothing would ever work. I'd have really bad side effects with them, that type of stuff. And then I found this place, talked with Tammy, and she thought it was good. We had a list of all the antidepressants that didn't work, and she gave me one she thought would work in conjunction with it. Honestly, just the results I've had compared to anything else I've tried, this is by far the best thing I've tried so far.
I would say our intake process to get new patients in the clinic may seem pretty extensive, whether that's referrals or multiple steps to take in order to see a provider first, but we do that to make sure that we have the most information possible about everything that hasn't worked in the past so that we can be the most productive that we can once patients come in for that first initial appointment. We want to make sure that they come in, get out, get what they need, and start that road to recovery.
We really specialize in treating people who have not responded to the traditional treatments for depression, things like Prozac, Lexapro, Effexor, other medications. We want them to know that we've got a number of treatments that are specialized that really work for a lot of folks and can make a difference in their lives and get them back to normally and feeling better. So that's the main thing.
Insurance will pay for it for depression. We've done research studies. We've looked at, for example, using it for ADHD, so we programmed our machine to do that. Although with that, we also have to ascertain, well, how many different drugs or treatments has a patient tried for this condition? So trying to help patients along the path to their journey of, it might not end with us, it might not start with us, but let's see at what point that will be helpful for wherever you are on your health journey.